Hello guys, hope you all are doing great. So, today our point of discussion is on a very important topic that everyone should be aware of these days, so before going ahead please subscribe to this YouTube channel right now. And also like and share the video at the end. Now, we are going to discuss about the device called pulse oximeter, as it is very important you should have with you nowadays and essential during diagnosis of COVID-19. So, pulse oximeter is not like something big device, but it is a simple, small, and lightweight device used to monitor the amount of oxygen carried in a person's body. This device attaches painlessly to your fingertip, sending two wavelengths of light through the finger to measure your pulse rate and how much oxygen is present in your blood. Once the oximeter device finishes its analysis, its screen will display the percent of oxygen in your blood coming from your heart as well as your current pulse rate. So now let's know the facts that you should be aware of before using oximeter. The first thing is blood oxygen saturation, also known as SpO2. So, your SpO2 reading gives estimation of the amount of oxygen in your blood. An SpO2 reading of 95% or greater is generally considered to be a normal oxygen level. However, an SpO2 reading of 92% or less, at sea level, suggests that your blood is poorly saturated. That means the amount of oxygen in your blood is less than the required level. Insufficient oxygen in your blood can cause a range of negative health conditions including chest pain, shortness of breath and increased heart rate. Then second thing to know is pulse rate. Your pulse rate is an estimation of the number of times your heart contracts per minute. According to the studies, normal pulse rate values for an adults range from 60 to 100 beats per minute. For some people, a pulse rate below 60 beats per minute indicates abnormally slow heart action, also known as bradycardia. It can cause a number of problematic symptoms including fainting, fatigue, chest pains and memory problems. A pulse oximeter gives you accurate insights on your SpO2 and pulse rate within a matter of seconds, empowering you to respond quickly and confidently to abnormal readings. As a result, many people with adverse heart and breathing conditions invest in personal oximeters for in-home use. Just note that, SpO2 and pulse rate measurements outside the normal range aren't always a sign of health issues. For example, your heart rate can be expected to increase during exercise, and oxygen saturation may decrease slightly but it should at least remain at 90% or greater. Now that you got a better understanding of the oximeter device and how to understand the readings. Let's understand why this device is important for a COVID-19 patient. The reason is, a pulse oximeter may indicate issues with blood oxygen levels which could be related to coronavirus because COVID-19 is not the only disease that causes low blood oxygen levels. A pulse oximeter is recommended for the early detection of COVID pneumonia, a potentially deadly condition seen among the most severe coronavirus cases, but keep in mind that other diseases like chronic obstructive pulmonary disease, COPD, asthma, and other non-COVID-19 lung infection can also result in low oxygen count. So knowing the importance of the device, I hope you may buy it and keep it with you for personal or family use, if you wish to, but all hospitals and most doctors have pulse oximeter where you can go to do your health assessment if you feel any discomfort. People with heart or breathing problems can rely on personal finger pulse oximeters to help them monitor these conditions under physician guidance. For example, individuals with asthma can leverage personal oximeters to assess the severity of attacks and exacerbations. Accurate pulse rate and SpO2 readings are very important for patients who are physically active or experiencing frequent drops in oxygen levels in their blood. For people with COPD, asthma, or any other lung diseases who want to stay active, the quality of their pulse oximeter is incredibly important. Fast, reliable oximeter readings play an essential role in helping patients adjust their oxygen flow when exercising, participating in social activities or spending time at home. That's why leading-edge finger pulse oximeters is a very important asset most of the people must have. I hope this video must have been helpful to you. Please give your comments below about if you use a pulse oximeter and how it helps you in daily life. Also, subscribe to my YouTube channel and like and share. So goodbye till my next video, stay healthy and stay fit. See you soon.